A common improvement saying is that every system is designed to get exactly the results that it gets. A system is a group of inputs and processes that come together to create an outcome. Improvement science emphasizes the system versus individuals as being critical to changing outcomes. This means that rather than blaming individuals for problems, we seek to understand the way a system works and test ways to redesign it to achieve better outcomes. In improvement, we often use the term change ideas to refer to the specific actions or solutions that we introduce to redesign or improve the system. Those working to change systems are often faced with the question of where to look for change ideas and how to determine if they are worthwhile to pursue. Change ideas can come from a lot of different places. It is essential that the people who experience these systems be consulted. They often have excellent ideas. Researchers and published literature can provide meaningful insights into evidence-based change ideas. Further, places where a system or process is producing standout results, often called bright spots, can reveal change ideas that could benefit the whole system. The goal is to think broadly to gather ideas from a diverse set of sources. To recap, when making improvements, consider a range of change ideas from a diverse set of sources, including 1. People with experience in the system. 2. Research and literature. 3. And lastly, bright spots. To learn more about learning from bright spots, watch our video, Learning from Variation. Let's consider a network of senior living communities collaborating to improve mental health and wellness among residents. Each improvement team working towards this aim includes staff, family members, and residents, especially those experiencing adverse mental health and wellness outcomes. Their shared expertise is critical to identifying change ideas. Another source of change ideas could be learning from similar senior living communities where mental health and wellness outcomes are exceptionally positive. For example, through the Improvement Network, the team learned about intergenerational interventions, including partnerships between local preschools and senior living communities to build bonds between generations. The team learned that this partnership resulted in significant boosts in mental health and wellness. They thought this type of change idea, building social connections, might be an excellent change idea to explore among residents in their community. When approaching systems change, a common mistake people and organizations can make is to look for one change that transforms a system. It's important to remember that a system is made up of complex processes, policies, and people who enable it to function. One change cannot reshape an entire system, nor address the complexity of change that needs to occur to achieve different results. Given the diversity of residents and their varying states of mental health and wellness, even an impactful change like a preschool cannot meet the needs of all residents. A diverse set of change ideas are required to meet the aim. One reason that a diverse set of changes is necessary is that not all change ideas have the same potential for lasting impact. Change ideas have varying degrees of power. You can think of these degrees of power in 3 levels. The first are change ideas that build will and awareness for change. These changes rely on individuals' behavior and memory. Level 1 change ideas typically include awareness campaigns, data collection and feedback, and basic standards. Returning to our senior center, the improvement team decided to focus on generating a variety of change ideas to build social connection. The improvement team started with Level 1 change ideas by launching a campaign to raise awareness about the ties between social connections to mental health and well-being. They also provided educational resources to residents and staff. But not everyone attended sessions or reviewed the materials, and with many competing priorities, reinforcement was needed. Change ideas that rely on individuals' memory and behavior are important to build understanding for why improvements are necessary. However, they do not fundamentally alter how the system works, and, on their own, will not lead to a lasting impact. The second category of change ideas are those that identify errors and prevent things from going wrong. These types of change ideas often include checklists, like those to ensure correct medication is provided, automated reminders, differentiation, or making the desired action the default. The improvement team looked at their system to see where there were opportunities to prevent social isolation. They identified meals as a key time for residents to meet socially. The dining reservation requirement created an unnecessary systemic barrier for solo diners. The team tested removing this requirement and created a group table for solo diners to sit together unless a resident asked to be seated alone. This category of change ideas is more powerful because these are changes to the system. In this example, eating in the dining room with others becomes the default for solo diners, unless they request otherwise. The third category of change ideas is the most powerful, using human-centered design to take advantage of habits and make a system visible and easy to follow. The team looked for ways to use human-centered design to encourage social connection. For example, in the dining room, they noticed that the small tables where people might eat alone were scattered throughout the room. They tested moving the tables closer together to encourage organic conversations. This idea makes the desired behavior of human connection over meals easier to achieve by taking advantage of a habit, dinner, and through a visible, easy-to-follow system. Change ideas based on human-centered design are the least susceptible to human error. They are integrated into how the system functions to make the desired action the easy thing to do. You will see from our example that while some change ideas are stronger than others, ultimately, we need a mix of different categories of change ideas to drive and sustain change. Finally, it's important to remember that all improvement requires change, but not all change is improvement. To understand whether or not a change idea is in fact an improvement, is important to test it through Plan, Do, Study, Act, or PDSA cycles before it is implemented widely. To learn more about testing change ideas, watch Shift's video, PDSA Cycles. In summary, when deciding what makes a good change idea, remember, a mix of many change ideas is needed to drive improvement. Change ideas have different levels of power. The most powerful change ideas go beyond relying on memory, making the desired behavior easy. Finally, not all changes lead to improvement. It's critical to test changes to ensure that they lead to the desired outcomes. To learn more and download tools and templates, visit shift-results.com.